तमसः परे स्वः पश्यन्त उत्तरं देवं देवत्रा सूर्यं गणमान् ज्योतिरुतमाम् ॐ चित्रं देवानां उरकारणीकं चक्षुर्मेत्रस्य वरुणैस्याग्नि आप्राध्यावा पृथिवी अन्तरिक्षं सूर्या आत्मा जगतः तत्सुषश्च स्वाहा.
O God, you are beyond darkness. The luminous sun represents you. Everything in this universe proclaims your glory. The wise are surprised and illuminated by your supreme nature. You have given vision to the sun, the sea god, fire god. The heaven, the middle region, and the earth are being sustained by you. You are the soul of the universe.
Pratna.
Om Takshashurdevahitam Purasta Shukramocharat Mashi Ma Sharadah Shatam Jive Ma Sharadah Shatam Srinyuva Ma Sharadah Shatam Prabhava Ma Sharadah Shatam Adinasyamah Sharadah Shatam Bhuyascha Sharadah Shatat.
Omniscient God, let us see for 100 years. Let us live for 100 years. Let us hear for 100 years. Let us live for more than 100 years.
We bow our head in reverence as each of the following mantras are being chanted. We pay obeisance or respect to Brahma, to the teachers, to the rishis, to the devatas, and to our Vedas.
Om Brahmane Namaha. Om Acharyebhyo Namaha. Om Rishibhyo Namaha. Om Devebhyo Namaha. Om Vedebhyo Namaha. Om Sarvebhyo Devebhyo Namaha. Om Sarvebhyo Devebhyo Namaha. Om Sarvebhyo Devebhyo Namaha.
Salutation to Brahma, to Preceptor, to sages, to gods, to Vedas.
Once more, sitting in an upright position, keeping our spine erect, we join together in chanting the Gayatri Mantra.
Om Bhurbhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. Om Bhurbhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. Om Bhurbhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat.
Let us be in union with your luminous nature, who is the creator of the three worlds and the giver of our intellect.
Pratna.
Om Namah Shambhavaya Cha Mayo Bhavaya Cha Namah Shankaraya Cha Mayaskaraya Cha Namah Shivaya Cha Shivataraya Cha. Om Viryamasi Viryamai Dehi. Om Ballamasi Ballamai Dehi. Om Tejoasi Tejomai Dehi. Om Ojoasi Ojomai Dehi. Om Manyurasi
salutation to the Almighty, the giver of bliss, happiness, and peace. May we be blessed with energy, strength, glory, courage, and patience.
We join together now in reciting the Universal Peace Prayer.
सर्वेषां मङ्गलं भूयात् सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् नन्दन्तु सर्वभूतानि निरातङ्कानि सन्तु च प्रीतिरस्तु परस्परं सिद्धिरस्तु च कर्मणां स्वस्यस्तु राज्ञो नित्यपः सम्प्रजाभ्यस्तते वास्तु स्वस्यस्तु द्विपदे नित्यं शान्तिरस्तु चतुष्पदे शान्तिरस्तु नो देवस्य भूर्भुवः स्वः शिवं तथा सर्वतः शान्तिरस्तु नः सौम्य भवन्तु भूतानि त्वं देव जगतः स्रष्टा पाता दैव त्वमेव हि प्रजापालय देवेश शान्तिं कुरु जगत्पते यो मे अर्यस्निहीयते तस्य शिवमस्तु सदा भुवि यश्च मां द्वेष्टे लोके अस्मिन् सोऽपि भद्राणि पश्यन्तु ॐ शान्ति शान्ति शान्तिः हरि ओम्.
Let there be good to all. Let all be free from sickness. Let all see good and let none suffer. Let all be happy and fearless. Let there be sympathy for each other and success for all work. Let there be prosperity to the leader who protects the people every day and also to the people. Let the bipeds and the quadrupeds be prosperous every day. Let there be peace in God's and in the three worlds. Let us and all other beings have peace everywhere. Creator and sustainer as you are of the world, you encourage godliness and establish peace amongst the people. Who is my friend today? Let him be in peace. And who is my enemy? Let him also be in peace.
Om Shanti 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 Hari Om.
At this juncture, I'll invite if we could just place a mic by the podium in anticipation for our discourse. Will a mic stand be needed? No, just the mic. And I will invite the teachers of the children's class to take the children downstairs. So all children, we are asking you to move quietly downstairs with your teachers for your Balvihara class. This morning, I believe they are all getting ready for that. So throughout this year, devotees, brothers and sisters, we have been engaged in discourses monthly gearing towards health and wellness. And we have throughout the year covered many parts and many aspects of our well-being and wellness that we find that are important and that contributes to our own comfort and to our own well-being. I'm sure all of you without exception would fear the most having to have some toothache that emerges possibly on a weekend where you are in excruciating pain and you are just praying for your savior in the form of a dental surgeon to assist you come Monday. So this morning, in keeping with that particular aspect, we have someone who is extremely qualified. He sits very quietly every Sunday together with his family, and he participates in all of the activities of the Mandir. But this morning, he'll be wearing his professional hat, bringing with him more than 2 decades of experience in terms of his profession as a dental surgeon. And I invite you now to welcome to the podium with a lusty round of applause Dr. Virendra Maharaj, please. So he makes his way up and he will do his presentation, and I'm certain he will facilitate some questions, time permitting, at the end. So if we can have the cordless mic also available when that juncture comes, I hand over to Dr. Virendra Maharaj.
Sitaram, everyone. I'm just putting on my timer so I don't go over time. So the discussion this morning, the talk this morning is on common dental problems and how to avoid them. And next slide. So this is not a comprehensive list. It's not necessarily, this is most prevalent than what I see in office, right? And I'm trying to create a little story with it. So from one goes to the other, and then everything else usually comes after that. Next slide, please. So gingivitis is basically inflammation of the gum. It happens if there's poor brushing techniques, poor flossing, or no flossing at all usually. Plaque builds up on the teeth, and then this in turn irritates the gum. And then you get bleeding gums. Usually when you brush teeth or floss, the gum starts to bleed, and you figure you're doing something wrong. But it's really because there is gingivitis happening. And it is a disease because it's caused by not just the inflammation, but the bacteria is actually causing it. And that because of the bacteria is involved, it's ranked as a disease. Poor oral hygiene, smoking, it's actually a very high risk factor. Over the years, so from the late 90s, it was a theory that smoking may contribute to it. Between then and now, a lot of studies have been done, and it shows that smokers are twice as likely to develop gum disease. Heavy smokers, pack a day and more, 4 to 5 times more likely to develop gum disease. Main reason for that, smoking, and this is, any of you who would have had surgery done, they would tell you stop smoking or limit the amount of smoking, because the smoking constricts the blood vessels. You get decreased blood flow to the tissues, to the gum in this case, and because of that, there's less oxygen getting delivered to the tissue, and it delays any healing. So if you have active gingivitis or gum disease, it actually makes it worse. And if you don't have it, there's a high risk of you getting it as a smoker. Hormonal changes, one example of this, there are many others, but one example is during pregnancy. The hormone levels fluctuate, and you get something called pregnancy gingivitis. So it doesn't mean that you're going to have gingivitis right through. It just means that during pregnancy, you're going to have gingivitis. It usually clears up towards the 3rd trimester, and by the time you deliver baby, it usually resolves on its own, but sometimes you need a cleaning in between there. Women who are on birth control, and sometimes they're on the birth control and then they come in and their gums are bleeding a lot, but they don't know why, because they brush and floss all the time. It's because of the hormonal changes. The birth control alters the levels of the hormones, and you get, again, hormonal changes causing gingivitis. Malnutrition, usually vitamin D deficiency, which we don't have a problem with, we shouldn't have a problem with here, because we live in the tropics. But in temperate countries, that plays a part. Protein deficiency, something that might be relevant to the vegetarians. If you're not getting enough protein, it can influence gingivitis. And then diseases like cancer or HIV, you do get a lot of bleeding and mouth sores as well. Certain medications, and this is actually a very common one, asthma medications, chronic asthma medications. If you're on asthma medications for a long time, you can get gingivitis. Calcium channel blockers, and that's usually like verapamil, and those are heart medications. Chronic use of it can cause gingivitis. Immunosuppressants, if you're organ transplant patients and HIV patients, some cancer patients, you get the gingivitis happening. And anticonvulsants, so carbamazepine, phenytoin, for those who have seizures, you can get a lot of gingivitis. It's not a direct cause. What happens, that medication actually causes the gum to grow more than normal. So it gets kind of puffy, and that in turn, because it's so puffy, it's kind of loose and it traps a lot of food stuff there, and then that in turn causes the gingivitis. So it's it's kind of like an indirect cause. And genetics. Genetics actually play a big part. And again, this was theories that were postulated in the earlys, and now more recent study, 2021, a group of Chinese scientists figured out there are actually 4 genes really, the MIT1 gene, CCR1, EDH4, and the FAM86C1 genes. Those are, if you have any of those genes, then you have a very strong risk of developing gingivitis. But usually if your parents had it, if one parent has it, you have a 50% chance. Both parents had it, more than likely you are at risk to gingivitis and periodontitis, which we'll go on to. So how to avoid? Regular checkups and cleaning. So this slide, you're going to see the slide popping up a lot, right? Because it's basically the same preventive factors, same preventive measures. Regular checkups and cleanings twice a year, usually every 6 months. Brushing and flossing for obvious reasons, right? Eat healthy. The diet has a lot to do with it as well. There are lots of foods that less plaque forming, and then there are foods that will contribute to it. And the smoking and the alcohol. Well, the smoking, we discussed that. Alcohol, there is a link between the two, but it's not a heavy association with it. So periodontitis, this is just gingivitis supercharged, right? So gingivitis, and you'll see a animation in a little while, hopefully. Gingivitis is basically inflammation of the gum. Periodontitis, so the tooth is in the socket and it's attached to the bone with tiny little ligaments. And when you get to this point, if the gingivitis goes unchecked, you don't correct that inflammation, and again, remember, there's bacteria in play here, right? So bacteria is part of the reason. That causes inflammation of the ligaments and the bone, and that whole scenario is now ranked as periodontitis. It's an advanced state of the disease, and usually characteristic, you get bleeding gums, bad breath, loose teeth meaning that the teeth shake. And all of a sudden you find that your teeth look longer than they were before. It's not that it's growing out, it's just that the gum is receding. Next slide. Yeah, and sensitivity. So because the gum has receded, now the sensitive parts of the teeth are exposed. And that, you drink normal water sometimes, just regular tap water, and you get this kind of shock on your teeth, and that's because the more tooth surface is exposed. Pain on chewing, so that's actually one of the more diagnostic symptoms. If you come in and say that you're chewing food and you're just feeling pain, it's because of the pocketing. So what happens? Remember, we said that the gum is inflamed, and when the gum gets inflamed, it pulls away from the tooth. So when you eat, stuff gets under the gum and it just packs in there, and it keeps packing in there, and that, when the gum pulls away, that's what we refer to as pocketing. So this is just a little diagram. On the left, healthy tooth and gums. And then as we go across to the right, so you have gingivitis, which is just the plaque building up on the teeth, maybe causing the gum to be a little bit inflamed. Periodontitis is where that pocket is developing. So that gum starts to move away. The plaque continues developing. The plaque turns into calculus, which is when the plaque gets hard over time. And that calculus traps more plaque. And it's just a vicious cycle. It keeps going on like that. And it starts to damage the bone and the ligaments. And then you have advanced periodontitis, where there's significant bone loss around the teeth. And then they start to, remember we spoke about loose teeth, they start to shake. And at that point, there's not much recovery from that in terms of saving the teeth. So usually the best chance to get it is at the gingivitis, even early periodontitis stage. So again, similar, right? Regular checkups and cleanings. Actually, just go back one, Amral, please. So in a 2008 study and a 2015 study, and they're more recent ones, but these are some of the early studies where they were establishing a link between periodontitis and heart disease, lung disease, rheumatoid arthritis, ischemic heart disease. And the reason why they were checking that is when they were investigating those conditions, the bacteria that they found in the bloodstream and in the heart in some cases and in the lungs, it was the same bacteria that you find in plaque and calculus. They've done more extensive studies since then, and they've actually proven a link. So in dental school, they usually tell you that you could diagnose any medical condition from the mouth. So this is one of the reasons why, because remember, this is the entry point. So you have a lot of bacteria building up, and that usually, if that gets into the bloodstream, just see animation again, Amra. No, the one before, just diagram, sorry. So if that bacteria in that plaque layer builds up enough, those two lines at the bottom of the tooth there, it's just a simplification, but it means it demonstrates that there's blood supply right nearby there. Most of you would know if you hit yourself with a toothbrush there, it starts to bleed, it feels sore. That's how rich the blood supply is. So once you have that bacteria building up, it's easy entry into the bloodstream, and that goes everywhere else, right? So that was the basis of the study, and they've actually proven that. So this is just an animation. I don't know if it'll play, but it was just a short animation showing you. Yeah. All right, so I could describe it in case it doesn't play. It was just a short animation showing you how it goes from gingivitis to periodontitis. So, yeah. So again, it's just there's no audio, so it just basically shows you the plaque building up, calculus building up. The gum gets, now very characteristic, once you have gum disease, the gum gets red. It's not supposed to be red, it's supposed to be pink. So if you find that your gum looks bright red, that usually means that it's usually inflamed, right? In terms of how we could avoid, so regular checkups and cleanings, for gingivitis, I mentioned that checkups and cleanings supposed to be every 6 months, twice a year. Periodontitis, it can be 3 to 4, maybe sometimes 5 times a year, because when you get to periodontitis, you want to try to reverse that condition as early as you can. And usually when you have that amount, so you see the teeth will loosen up over time, and then you'd have seen the gum receding, and then that's why the teeth look suddenly longer. So if you have periodontitis, you really want to try to reverse that condition as early as you can, as soon as you can. And that's why you have increased, we recommend at least 3 to 4 times for the year, every 3 months as opposed to every 6 months. In very severe cases, you might find that it might be every month or every 2 months, at least until you get control of it, and then we can lengthen that time period. Flossing and brushing, usually when you get to this point, a water pick helps, a water flosser, because of the deep pockets. So sometimes the floss really can't get all the way down. Also, another form of treatment is surgical access. So apart from cleanings, we can do it surgically. So we can get access to the tooth itself in a surgical manner and then clean everything that way. And scaling and root cleanings, deep cleanings, where we give anesthetic and clean under the gum. There are newer forms of treatment, gingival grafting and bone grafting. So periodontitis is where you lose bone around the teeth. So you can create access surgically, put bone graft, and then do a gingival graft, which is where you take your own gum, and graft the area, so kind of build it back up. It's not as predictable as we would like it to be. Bone grafting in an open space like that, you lose it tends to be less predictable once you start just resting bone there and trying to cover it up. If you extract a tooth and put bone into the socket, that has the best outcome. But once you start losing walls, basically, it becomes less predictable. So sensitivity, and I'm sure most of us have had sensitivity in one form or the other. Exposed tooth root or roots is usually from the periodontitis, where the gum recedes and then the roots of the teeth are being exposed. Enamel wear, if you're brushing with anything harder than a soft toothbrush, then you can get that. So the fractured teeth, chipped teeth, tooth decay, cavities, self-explanatory, right? There's a big hole in the tooth, and sensitivity is actually usually one of the first symptoms. Teeth whitening can cause it. So if you're, if you're into whitening, the chemical in the teeth whitening gel tends to sensitize the tooth, and bruxism. We'll come back to that. That's a slide at the end, but that's basically grinding teeth. So if you're grinding your teeth, we'll come to have a separate slide on that, because it's actually more prevalent than a lot of people think. How to avoid it? Well, sometimes it's not as straightforward as just making something or doing something to avoid it. Regular checkups and cleanings again, twice a year, to see if there's any indication that you might be you're getting sensitivity, or if you're getting sensitivity, try to pinpoint it. Desensitizing toothpaste, you all know about Sensodyne. Colgate has different brands of them. Fillings for those teeth that have cavities in them, and oral appliance. So we'll come more to that again, but that is like a night guard if you're grinding your teeth, or a day guard if you're grinding your teeth during the day. Yeah. And cavities, Again, it's caused by bacteria and it depends. It highly depends on your diet. So if your diet consists of high sugars, now I know we all eat snacks and sweets and stuff, right? So it's not I don't mean the occasional snack or the occasional sweets. Yes, parsad and yeah, it's not about that, because that's not. I mean, once you're not doing it all day every day, you're okay. The high sugar diet is if you have 4 or 5 cups of tea or coffee with 3 spoons of sugar in it and condensed milk in it every day. Yeah. And if you go to bed, some of you would have seen kids, young kids, 1, 2 years, 3 years, with lots of cavities in their mouth because they drink milk before they go to bed. So a high sugar diet doesn't just mean granulated sugar or brown sugar. High sugar diet means milk. Milk has milk has sugars in it. Fruits have sugar in it, right? So once you're brushing and flossing effectively, and definitely before you go to sleep, then that usually helps. But the high sugar diet is something that, I mean, apart from cavities, just health-wise, it's not good. Poor oral hygiene. So again, if you're not brushing or flossing, and dry mouth. Some people have a condition called dry mouth syndrome. Certain medications can cause it. There are certain heart medications that cause it. There are certain what they call anticholinergic medicines that cause it. But dry mouth, if your mouth gets dry all the time, what happens is that bacteria doesn't get washed away. Your saliva actually plays a role in cleaning up the mouth a little bit. So if that bacteria remains on the teeth, then you're more susceptible to developing cavities. So, how to avoid? Again, checkups and cleanings, proper diet, radiographs. So when you do checkups, we usually recommend x-rays done every 6 months. In certain cases, if you've been coming every 6 months and there are no cavities, then we may not stress too much on the every 6 months, but it's useful because remember, what we could see, we can't see in between the teeth. The x-rays are very important for showing in between the teeth, which is usually where some cavities start. When you feel it or when you see it is usually when it reaches to the top of the tooth and kind of everything's exposed. So in those cases, fillings, yeah. So missing teeth, and this encompasses, it's a wide topic, but gum disease is the #1 factor why people have missing teeth. There is trauma. So if you've been in an accident, playing cricket and the ball hits you and breaks a tooth or knocks a tooth out. There are also many genetic reasons. Hypodontia. Hypodontia is more associated with cleft lip, cleft palate. People with Down syndrome, if you're actually born with a low birth weight, there is some sort of correlation there. And of course, if you have Candida or rubella early on, sometimes that can cause hypodontia or missing teeth. There is a strong genetic link. So again, if one parent or 2 parents are missing teeth, it's autosomal dominant, and there's also a recessive gene as well. So if one parent or both parents are missing teeth, or they just never had teeth come out in certain areas, then chances are you may have that, or you may notice that as well. And then cavities, well, if the cavity gets too big and there's no coming back from it, then you gotta take it out, right? And then you end up with a space. So treatment options, there are many different treatment options. You could just leave it alone, right? You could just leave the space there. But in terms of function, obviously if it's a front tooth, you want something there. Implants, first line option. Implants are surgical options where you place the implant into the bone and then you build up on that. You put a post on it and then crown it. Crown and bridge, so basically we bridge the gap with 2 crowns and then dentures which are removable. All right? And then of course the fourth option, like I said, if you decide you don't want to do anything there, that's also an option, but you'll have a space. So grinding. This is the bruxism that we talked about in the last, well, one of the early slides. This is actually very prevalent. Maybe because of education, maybe because people are being more aware of it. But I see a lot of 15, 16-year-olds with bruxism. And the stress and anxiety is usually the number one. If they come in, my first question to them is, when is exams? And they'll tell you 2 weeks' time, 3 weeks' time. Big exams coming up. And it's a huge, again, I over the years, we're actually seeing more and more of it. And even with adults. And if it's happening in the night, it's usually a very characteristic, it's a grinding sound. Most people, when they hear their spouse or partner grinding or hear that sound, they usually think, well, that's normal. I do that too, right? I probably do that too. But that sound, when you hear it, that's actually a very, very characteristic sound. Certain medications can cause it, but stress and anxiety, that is anger, frustration, the overall stress of it. Ties in with personality. If you are the type of person that is hyperactive, aggressive, competitive, you tend to be clenching, grinding. Certain medications, again, the anti-seizure medicines, antidepressants, ADHD medications can cause the grinding or the clenching. Sleep apnea, sleep problems, and again, a lot of people actually suffer with sleep apnea and they're not usually aware. Now, if you go to sleep and you just suddenly jump up and you're trying to gasp for air, then that's usually a sign of sleep apnea. And the sleep apnea, once you're not getting enough sleep, let me rephrase that, once you're not getting enough quality sleep, and quality sleep is the REM sleep, continuous sleep, you tend to be more on, what they say, you're more on edge, you tend to be grinding or clenching. And then, well, substances, alcohol use tends to lead to this, and other drug use, you see it in patients that are using other drugs. I put possible vitamin deficiency. It's not a conclusive study, but usually I find thiamine B5 in some patients with it. What happens if you're grinding your teeth? It's just like 2 stones, and you keep rubbing that, eventually it will wear down, right? Now bear in mind, the nerve is in the middle of the tooth, right? And then you have the dentin and then the enamel over that. And once you start knocking off those layers, the nerve is not going to move. So eventually you're going to start coming closer to the nerve. You're going to start getting sensitivity. And then if it continues and you reach the nerve, well, then that's when you start to get pain. Fractured teeth, certain teeth, if you keep grinding, if you keep clenching on them, yeah, they will break because they're getting weaker. And you find that most grinders, if you lift weights and your muscle gets bigger, same thing, right? If you are grinding all night, these muscles here, you tend to find grinders, these muscles tend to be very enlarged because they're working all night. You know, they're getting a workout every night. Those last two symptoms, sign for the dislocation, but usually people will tell you when they come in, they're opening and they're hearing like a click, or they're hearing like a pop. And in more severe cases, if they open wide, they tell you they're yawning, and then all of a sudden their jaw dislocates, right? And sometimes we're doing stuff in somebody's mouth, and you tell them open wide, and all of a sudden you see the jaw will just shift. So now we have to reduce the dislocation and put it back in. That's usually a sign that you are grinding or clenching. Treatment options, behavior changes. Change your personality. Just be less stressed. I laugh about it, right? But I know it's not as simple as just saying, all right, go home and be less stressed. It doesn't happen that way. But it's a gradual process. It's about not, it depends on your personality. And some people find it easier than others. Some people just can't do it at all. Appliances, so we can make appliances. A night guard if you're grinding in the night. If you're grinding and snoring, anti-snoring appliance. If it's happening during the day, then something called a day guard. It's similar to a night guard, but you can wear it and it's not very visible. And there's actually one I left out here, biostimulation, which is, it's a way of sort of altering the firing of the muscle by electrical stimulation. And then medication or Botox. So medications can work, muscle relaxants can help. But of course, that means you're going to be on muscle relaxants all the time. Botox. So a lot of you would have heard about Botox. Botox they're using for TMJ dysfunction now, because the Botox is actually a toxin, right? It paralyzes the muscle a little bit. And that's why you see some people do cosmetic surgery and they get Botox injections and their eyebrow goes all the way up here. And they can't control it because that's the muscle is paralyzed, so they can't. So it helps, I guess, but for TMJ dysfunction, it eases up the firing of this muscle here. Right? So you're not working it, you're not overworking it all night. So smoking and alcohol consumption. The alcohol consumption especially disrupts your sleep. You don't get that continuous REM sleep. It applies to this, but for the grinding, that alcohol use, you don't get that continuous sleep, right? I just dropped in these two. It's not for private practice. We may not see it as often as the hospital will see it, but oral cancers, smoking and alcohol consumption, HPV and EBV, Epstein-Barr virus, and human papillomavirus. Some of you would know especially in the North American countries, there's a huge drive for HPV vaccinations. We have it here as well. And this is one of the reasons. One of the most prevalent viruses that they found in cancers, the oral cancers, and they've postulated that it might actually cause some of it, is the HPV virus, the human papillomavirus, and then there's Epstein-Barr virus. Genetics play a part, as with most cancers, I guess. Dr. Gyan will confirm, but genetics usually plays a big part in it. And then mouth sores, canker sores, after ulcers, it goes by many different names, just a general umbrella term here, mouth sores, HSV, chickenpox can cause it, vitamin B12, iron deficiency, and then Crohn's and celiac disease usually get a lot of mouth sores with those diseases. And again, this is more diagnostic for us. If I see a patient coming in with a lot of mouth sores, and it's not going away, and it's just repeatedly coming, then we have to look at some other underlying cause. Right. So that's my presentation. So, if you all have any questions.
Thank you very much, Dr. Maraj. So we will facilitate a couple of questions, if there are any, and because it's a very comprehensive presentation, if you would prefer to have a quiet conversation with Dr. Maraj after that, could be facilitated as well. So I'm not seeing any hands coming up. Well, there's two, so Jenny and Uncle Ajoda in that order, and then we will suggest if you could pass the mic, Daryl, to Jenny first.
When you say worms, what? Not that I know of, but usually kids tend to grind their teeth sometimes. So at that age, and maybe 6, 7, 8, maybe up to 10, I wouldn't be too concerned about that at that point. Usually is the 12, 13, 14 upward, because most kids at some point in time tend to grind their teeth. It usually stops. But if it's not stopping, then it might be something to look into, but I don't know of any correlation between worms. Indirectly, that may cause us a bit of stress on their bodies. So from that point of view, it might have a link there.
Dr. Maraj, my question is, during a dental procedure, if the patient happens to swallow the blood together with the spit, is that likely to affect the other organs in the body?
If they swallowed blood?
Yeah.
Yeah, no, that wouldn't affect anything at all. Usually once that goes, by the time it reaches the stomach, because of the intensity of that stomach acid, nothing much lasts in there. So you're safe. That wouldn't cause any problems at all.
Okay. My other question is, with regard to diabetics, can they end up with sores in the mouth if the sugar level is uncontrolled?
So uncontrolled diabetes, you can get increased gingivitis, increased risk of gingivitis. Periodontitis, the problem with uncontrolled diabetes is that when you start getting gingivitis, periodontitis, even sores, it takes a long time to heal. The longer it takes to heal, the bigger the problem becomes. So if you have gum disease and you're diabetic and it's uncontrolled, then you might find that you're doing everything, but it's just not going away, right? Because that high blood sugar, it delays the rate of healing for anything. Surgeries, if you do surgeries as well. But yes, you do as a diabetic, even if you're hypertensive, but more so diabetic, there is usually sometimes a higher incidence of those mouth sores. But most of the time, most of the time if you do get a mouth sore, 7 to 10 days it's usually gone. But if you're diabetic, it might last a little bit longer. So it may not be that you're getting more, it just means that it's just sticking around for a lot longer. And it might seem like you're just getting it all the time, if that makes sense. Yeah.
Right, so thank you very much, Dr. Maharaj. Please give him a round of applause for a wonderful presentation this morning. And I'm sure he would be open to other questions. You could speak with him privately. We now invite you to please come forward as we engage in RT and in our offerings. So please do so at this time.
मानस भजरे गुरुचरणं दुष्टर भवसागर तरणं मानस भजले गुरुचरणं दुष्टर भवसागर गुरुचरणं दूसर भव सागर शरणं गुरु महाराज गुरु जय जय 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 साईनाथ सद्गुरु जय जय सत्य साईनाथ सद्गुरु जय जय सत्य साईनाथ सद्गुरु जय जय सत्य साईनाथ सद्गुरु जय जय ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव 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 ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा गुरु महाराज गुरु जय जय गुरु महाराज गुरु जय जय साईनाथ सद्गुरु जय जय सत्य साईनाथ सद्गुरु जय जय मानस भज रे गुरु चरणं दुष्टर भव सागर तरणं मानस भज रे गुरु चरणं दुष्टर भव सागर तरणं गुरु महाराज गुरु जय जय गुरु महाराज गुरु जय जय साईनाथ सद्गुरु जय जय सत्य साईनाथ सद्गुरु जय जय ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः ओम नमः शिवाय ओम नमः शिवाय ओम नमः शिवाय शिवाय नमः ओम अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव ओम अरुणाचल शिव अरुणाचल शिव अरुणाचल शिव अरुण शिव ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा ओंकारं भव ओंकारं भव ओंकारं भव ओम नमो बाबा गुरु महाराज गुरु जय जय गुरु महाराज गुरु जय जय तरणं दुष्टरभवसागरतरणम् बोलो बोलो सब मिल बोलो ओम नमः शिवाय 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 बोलो बोलो सब मिल बोलो ओम नमः शिवाय बोलो बोलो सब मिल बोलो ओम नमः शिवाय जूत जटामी गंगा नारी जूत जटामी गंगा धारी त्रिशूलधारी डमरू बजावे
त्रिशूलधारी डमरू बजावे
डम 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 डमरू बजे
दम 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 डमरू बाजे
गूंजता ओम नमः शिवाय
गूंजता ओम नमः शिवाय
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 हरि ओम नमः शिवाय
हरि ओम नमः शिवाय
ओम नमः शिवाय
हरि ओम नमः शिवाय
बोलो बोलो सब मिल बोलो 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 ओम नमः शिवाय
ओम नमः शिवाय 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 ओम नमः शिवाय
बोलो बोलो सब मिल बोलो ओम नमः शिवाय
बोलो बोलो सब मिल बोलो ओम नमः शिवाय
जूत जटामी गंगा डारी
दूत जटा में गंगा धारी
त्रिशूलधारी डमरू बजावे
त्रिशूलधारी डमरू बजावे
त्रिशूलधारी डमरू बजावे
त्रिशूलधारी डमरू बजावे
डम 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 डमरू बाजे
दम 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 डमरू बाजे
गूंजता ओम नमः शिवाय
गूंजता ओम नमः शिवाय
गूंजता ओम नमः शिवाय
गूंजता ओम नमः शिवाय
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 हरि 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 ओम नमः शिवाय
बोलो बोलो सब मिल बोलो ओम नमः शिवाय
This will be our final bhajan before announcements.
Shiva bam 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 bhola bajave damaru. Shiva bam 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 bhola
bajave damaru.
O Shiva bam 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 bhola bajave damaru. Shiva
bam 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 bhola bajave damaru.
bajave damaru. Bajave damaru.
Bajave damaru. Bajave damaru.
Bajave damaru. Bajave damaru, bajave damaru, Shiva bam 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 bhola bajave damaru, Shiva bam 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 bhola bajave damaru, O Shiva bam 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 bhola bajave damaru, Shiva bam 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 bhola bajave damaru. Koi charawe paan phool, koi charawe mala, 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 koi मांगे मांग रहा है गोरी लेके बाला. शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू, ओ शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू. अंधनों को आँख दे, कोढ़ियन को काया,
अंधन को आँख दे, कोढ़ियन को काया.
अंधन को आँख दे, कोढ़ियन को काया,
अंधन को आँख दे, कोढ़ियन को काया.
बाजन को पुत्र दे, निर्धन को माया. शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू, ओ शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू. बजावे डमरू, 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 बजावे डमरू. शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू, ओ शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू, ओ शिवा बम 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 भोला बजावे डमरू, शिवा बम 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 भोला बजावे डमरू.
So let me extend a warm welcome to each and everyone this morning. Those of you who are with us physically, those of you who are joining us online, and welcome to our satsang on a Sunday morning, which runs each and every Sunday from 8:30 to 10 a.m. For those of you who would wish to make contributions towards the upkeep of the Mandir, we invite you to see one of the members of our management committee or treasurer, Mr. Roger Bisoon, or any other member after service so that you can make your contributions. All contributions are welcome. And for those of you who would want to sit to perform puja or hawan on a Sunday morning, we invite you as well to see Mrs. Rama Sharma Umarao, who is sitting at the front, and you can give your name so that the necessary arrangements can be made. Please be reminded of some upcoming events. On the first Saturday in December, that's the 7th, we will be having Hanumanji Puja, and that will be from 8 a.m. So those of you who would like to come, that's just the puja we're performing. It isn't a lengthy philosophical discourse, but it is the opportunity for us to sit together to perform puja and to render verses of Hanuman Chalisa. So that will be at 8 a.m. on December 7th. You're all invited to attend. As I indicated last week, on the 15th of December, we will be having that Sunday, we will be having Satnarayan Swami Puja being performed that morning, but we will also be having a visiting Swami from the Ramakrishna Mission, in India, and he will be visiting us that morning. So we invite you to be with us for his darshan and indeed for the pravachan that will be delivered, and that's on the 15th of December. For all persons who are celebrating their birthdays this upcoming week, we want to extend birthday greetings to you. And that includes, in her absence, Mrs. Lalu, who is normally here every Sunday. She's celebrating her birthday on the 28th. And Mala's eldest, Sanjeev, who is celebrating his birthday as well. We want to express birthday greetings to him. I want to apologize, firstly. It has been our mandate and our practice to account to you, our devotees and our constituents, each and every time we have a fundraiser. The last fundraiser held by the Mandir would have been the Bhajan Amrit that was held earlier this year, and we do apologize for the late accounting of this to you, and you'll understand why shortly. 119 Bhajan Amrit sheets or donation sheets were distributed, and as of the 13th of November, we were able to collect 112 of those sheets. So the reason for the delay in accounting for you was the tardiness in persons delivering back those sheets. And as of today's date, 7 sheets still remain unaccounted, well, unreturned, let me put it that way. We know who the persons are, but we can no longer hold back the accounting because of that. So that's the reason we took to close off the account and to account to you. And it is therefore from 112 sheets collected, the total donations made by persons on those sheets were $126,261. Please give them a round of applause. There was some expenditure incurred for food and refreshments that were provided, for security for the sound system that was operated by an independent third party on that day to allow for the smooth flow. Those expenses came up to $7,290, and therefore the net receipts or profit was $118,971. Now, while that might sound significant, you would appreciate that since that time to now, a number of improvements have been undertaken at the Mandir, including many things that you see around you, and you would have observed, particularly as well, the lighting systems in the Mandir. I want to thank Mr. Ricky Sam Gram Singh for his donation of labor, but all of the fixtures had to be purchased and so on. So you see, the monies that you raise and that you contribute and so on immediately start going back into the expenditure of the Mandir. Indeed, it is the recognized fact, and our treasurer can adhere to that, that we need on an annual basis at least $150,000 in addition to our regular collections of RT each and every Sunday in order to meet the recurrent expenditure of this Mandir in terms of bills, expenses, and minor improvements that have to be done. There are some major projects that I will not outline this morning that have to be done to ensure the integrity of the building and your safety, and that is being looked at right now by the management committee. Certain costings through the engineers are being done, and you will be advised of that. So when we think that this is a large number, and you know there's always the accusation, oh, Krishna Mandir is for rich people. It isn't. It is the $20 and the $5 and the $1 bills that you contribute that make up these numbers, and that it allows us to have this facility running in a standard in which you're comfortable, you're safe, and persons can come and enjoy the ability to worship and to perform their devotion in a safe way. So we urge you to continue to support us in our initiatives. You will see the various achievements being done. For example, the children of the Bal Vihar class, the room was repainted and refurbished for their comfort and enjoyment. Through the kind donation of someone, a television was put in there so that this children's class now has the benefit of the audiovisual technology that will allow them to continue growing that Bal Vihar class. And I must commend the parents and grandparents for bringing out so many of the children this morning. Please accept and congratulate yourselves on that regard. Many other announcements. Anil G is working together with me on, he's spearheading it on a wonderful program that we hope to launch for the youths early in January, and that's a youth development program. So all of the youths who are here and who are very well networked on social media, I want you to spread the message, because you are taken to the Bal Vihara class up to age 12 or 13. And then what we found through our strategic planning exercise is from 13 straight onwards, there is a gap where we are not catering directly for the needs of our young people. We would have thought that the benefiting of the discourses on a Sunday morning would have filled that gap, but that has not occurred in the way in which we would like it to. And so there has been a decision to develop a formalized program. You will be graduated after that program. You will be awarded a certificate, and that certificate you could use in your resume when you're applying for university degrees or when you're applying for entrance to university and for jobs and so on. That will be testimonial to what you've done. Finally, before I conclude, I want to congratulate Vasudha for her tremendous performance in the recently concluded jingle competition hosted by the Children's Authority. And Vasudha, I must say, this week gone by, I was contacted by the San Fernando City Corporation to have a representative of the Hindu faith to deliver a prayer at a civic ceremony. And I called upon her, and very willingly she went. And from all reports, she really represented the Hindu community extremely well. So again, thank you for that. And we want to develop that talent and that pool so that when we have to represent the Hindu community in San Fernando and in the country, I could just pick up the phone and call anybody here, and I know that you would be willing, able, and most willing to represent the Hindu community. With that having been said, let us all now stand for final arti. I do apologize for running over a few moments, but it was necessary to account, and we will close now with Arti Bhajan and closing prayer.
Om Jai Jagadish Hare Swami Jai Jagadish Hare Bhakt Jano ke sankat Das Jano ke sankat Chale dur kare Om Jai Jagadish Hare तुम मेरे शरण कहो किसकी स्वामी शरण कहो किसकी तुम बिन और न दूजा तुम बिन और न दूजा आश करो जिसकी ओम जय जगदीश हरे परमात्मा तुम अंतरयामी स्वामी तुम अंतरयामी पार ब्रह्म परमेश्वर पार ब्रह्म परमेश्वर तुम सबके स्वामी ओम जय जगदीश हरे तुम करुणा के सागर तुम पालन करता स्वामी तुम पालन करता हम सेवक तुम स्वामी हम सेवक तुम स्वामी कृपा करो भरता ओम जय जगदीश हरे तुम हो एक अगोचर सबके प्राणपति स्वामी सबके प्राणपति इस विधि मिलो दयामय इस विधि मिलो दयामय तुमको मैं कुमति ओम जय जगदीश हरे दीन बंधु दुख हरता तुम रक्षक मेरे स्वामी तुम रक्षक मेरे अपने हाथ उठाओ अपने हाथ पार पराते रे। ओम जय जगदीश हरे, जय जगदीश हरे, स्वामी जय जगदीश हरे। भक्त जनों के संकट, दास जनों के संकट क्षण में दूर करे। ओम जय जगदीश हरे, ओम जय जगदीश हरे, ओम जय जगदीश हरे।
Hari Om. We pray this morning for ourselves, we pray for our families, but more than that, we pray for those persons who may be ill in some way. We pray for those persons who may have lost a loved one. We pray for those persons who are confronted with some sort of anxiety or some sort of difficulty. We pray for those persons in particular who engaged in acts of criminality, that their minds and their hearts and their actions would be redirected towards a nobler purpose. For, O Lord, you are mother and father, you are family, you are friend, you are knowledge, you are wealth, you are everything to us. We join together in closing prayer. Hari Om. Tvameva Mata Cha Pita Tvameva, Tvameva Bandhu Cha Seka Tvameva, Tvameva Vidya Dravinam Tvameva, Tvameva Sarvam Mama Deva Deva. Om Sato Ma Sargamaya Tamaso Ma Jyotirgamaya Mrityurma Amritam Gamaya. Om Shanti 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 Hari Om. प्रेम से बोले श्री गणेश भगवान की जय, उमापति महादेव की जय, वृंदावन बिहारी लाल की जय, आज शक्ति जगदम्बा देवी मैया की जय, श्री पवन पुत्र हनुमान की जय। प्रेम से बोले श्री सच्चे सनातन धर्म की जय। चिंतित around you, सब कोई जय जय सीताराम। Have a very powerful, very productive week ahead. As you leave this morning, please partake of the prasad that is awaiting you outside. And again, once more, many, many thanks to Dr. Maharaj for his wonderful discourse this morning. Jai Sitaram, everyone.